Hey guys, welcome. I'm going to make a quick video demonstrating the differences between urgent care and emergency rooms, when you should go for what service, and of course how it all ties into your health insurance policy and benefits and ultimately your out-of-pocket costs. So generally, urgent care centers are really for non-emergency cases. They're typically open late and open on weekends and holidays, and anything that you're not bleeding, so like minor cuts, sprains, urinary tract infections. They have urinalysis machines on site. There's an x-ray on site for any minor injuries. There's laceration kits and suture kits if you have a minor laceration that can be sutured up on site. Anything like a headache, stomach ache, cold, flu, sinus infections, tummy aches, those are all situations where you can go to urgent care. Now with COVID, you can also go there for COVID testing, most places. Make sure you just call in and see if they have enough tests on site, and if they are scheduling appointments or they're taking walk-ins for COVID testing. Also nowadays, you don't want to go to an urgent care or emergency room if you don't have to, especially if it's not COVID related. So definitely check out my video on telemedicine and telehealth and when that's appropriate to use, and it's really an amazing service that you can use from home. Essentially anything that you think to go to an urgent care for, you can use a telemedicine app or service as a first line of defense to see, hey, do I even really need to go out of my home for this reason? Now, emergency rooms, when should you go there? And that should be pretty obvious. Like if you are bleeding, you had a major head injury or trauma, major car accident, heart attack symptoms, stroke symptoms, severe burns, lacerations, anything that's going to require a surgical procedure, definitely go to the emergency room. Call 911 if you need an ambulance, you can do that. But I want to talk about what does it mean from a health insurance perspective of where you can go and when should you go there. So I want to use an example. Let's say you are just doing your job, or maybe just cutting some onions, and you hurt your hand, or you cut your hand and now you're bleeding. It's not too bad, but it's bleeding. You got to wrap it up. Where should you go? Should you go to the emergency room or the urgent care? My initial recommendation is going to be an urgent care center, because like I said, they're going to have, if you have a hand injury, your doctor is probably going to want to do an x-ray and make sure there's no fractures or broken bones. There's an x-ray on site. If you're bleeding and the bleeding's not stopping, they may want to suture that up. There's suture kits on site. They can handle lacerations at an urgent care facility. Now, what determines your out-of-pocket cost and how it works on the insurance back-end side is you go there for your test, they do a consultation, an x-ray, and maybe a minor surgical procedure to suture up that cut that you just had. The services that the provider is billing to insurance, after they bill that to insurance, whatever your policy benefits are, that's going to apply on top of that. If there's anything remaining after your insurance pays your benefit, that's what you as a patient is going to be responsible for. Now, how can we ensure or try to make sure that we have the least out of pocket when we go in for services? If you know that I just need some suture and maybe an x-ray, going to an urgent care for the same services, the provider is going to bill a lot less to the insurance company for the same x-ray than if you were to go get it done at an emergency room. So if you have some of that insight that I can get this taken care of at an urgent care, definitely select that option first, because not only are they going to bill lower for the same service, the radiologist is just going to review that x-ray. It doesn't matter whether you get it done at an urgent care or an emergency room. It's going to be the same process, and you're just going to have a lot less out of pocket because you're billing less to insurance. Whatever your insurance policy benefit is really stretching farther. Therefore, your out of pocket is going to be less if you were to go to a smaller facility to get that same x-ray done, an urgent care versus an emergency room. So I hope that was clear, but if you guys have any specific questions of when to go where, definitely make a comment and I can try to address that. Of course, it's a specific case-by-case situation, but just to give you an idea of the back-end insurance aspect and how that works and how you can try to ensure that you have less out of pocket for the same x-ray. All right, guys, hope you enjoyed that. Let me know if you have any questions.